Hi, I'm Mike Morrissey. Every year, a group of 30-plus medical professionals travel to San Lucas Toliman in Guatemala to perform orthopedic surgery on local children. In March of 2019, I joined the team to document their work.
Hi, my name is Constantine Kokenes. I'm an anesthesiologist from Atlanta, Georgia. An anesthesiologist, along with anesthetists, which are nurse anesthetists, and also physician assistant anesthetists, we're the ones who put people to sleep and, of course, wake them up. So that's part of the package, you know. And we also do nerve blocks to make them numb. We do spinal shots to make them numb. In other words, we render you pain-free during surgery in one form or another. That's our job.
As I've been videoing the surgeries, I've noticed you sitting in front of a massive amount of equipment. What is it that you're doing with all that equipment?
Well, we have a number of electronic monitors which help us follow the patient and monitor a number of physiologic activities of the body. We can measure how much you're breathing, we can measure the oxygen content of the blood, we can measure the carbon dioxide that you're exhaling. We look at the EKG to see how your heart is beating. We measure blood pressure to see where you are there. We measure urine output. We watch the blood loss. We add IV fluids. We're doing about 10 or 12 things, all of which is to keep you alive and stable during the surgery.
Yesterday, I videoed a hip surgery of a young girl which required a large incision to access her hip and leg bones. A question came to mind. What happens with the pain?
Okay, pain is a funny thing. Aristotle, the Greek philosopher, called pain the suffering of the soul. Pain is only felt in the brain. And so what's happening out in the extremity will send nerve signals, but if those nerve signals are either blocked by local anesthetic, which numbs the nerve, that they never reach the brain, or if the brain itself is numbed by general anesthesia, there is no pain.
So there's no record of it?
Well, that all depends on the depth. Certainly with a local anesthetic block, where the patient is totally awake on the other end, there's no record of that. It never reaches the brain. As to what happens with an anesthetized patient, I don't suppose you could really know. It's just that if you have achieved an adequate level of anesthesia, the patient has no recollection, and also his body does not indicate that it's feeling pain. If the anesthesia is a bit light, you'll see the heart rate go up, the blood pressure may go up, the breathing rate may go up if they're breathing spontaneously, and all of that tells you that some of the pain is getting through, and the patient won't have any recollection of it. The other important thing is that it won't be perceived as something noxious. In other words, in those situations, the brain might be registering some pain coming through, but it doesn't necessarily bother the body so much, or bother you so much.
Constantine, how did you get involved in this medical mission?
I'm glad you asked that question. And I have thought about the answer to this, but it's true. I was asked to come on medical missions. I had vaguely thought about medical missions my whole life as a doctor, but I had 3 children to raise, a family and all that. I never quite got around to making it happen. And then there was the earthquake in Haiti in 2010, and we were in Atlanta, very close, and a bunch of people said, let's go. So we hooked up with a big international group, and we went down to Haiti. It was a crisis mission, and it was amazing. And a few months later, I'm walking down the hall of the operating room, and a surgeon says to me, I hear you do missions. And I was like, well, I've done one. And he said, well, I need an anesthesiologist in 2 months to go to Honduras. I said, well, let me check my schedule, you know? So I saw him the next week, and as it happens, I was off that week. So I said, well, I'm off that week. He goes, good, I've already signed you up. And that's how I got going on missions. I went to Honduras, to the Medical Center of St. Benedict Joseph in Comayagua, San Benito Jose, and just loved it. And I've been going like twice a year ever since. They put me on the board of the hospital. Okay, to show you it wasn't of my volition, I had heard that Steve Miller was doing mission trips to Nepal. And so I wanted to get on that team. So I wrote him an email and I sent him my CV. I said, I'd like to be considered. This is years ago. And he said, well, thanks, we've already got anesthesia covered. So I let it go. And then several years later, I got an email from him out of the clear blue saying, would you like to be anesthesia and come on the trip to Guatemala? So I would like to tell people, it wasn't my doing, I just responded. And I thought about all this later and I thought, Thomas Merton, said that the spiritual life is a life of response. It's good to plan to do good things. It's much better to respond when someone is in need and asks. So that's how I got involved in missions.
That's a wonderful story.
It's a true story.
Thank you, Constantine.